So in case you missed the live Q&A that we were talking about all the GLP-1s, all those peptides, if you have any questions, please feel free to call us and ask. But I'm going to do a little bit of a little video just to answer any of the more common questions that are asked. And if you want to revisit this and come and look at it, just go do that or give us a call. So I'm just going to go through some of the main questions that people have. So I guess what a lot of people ask is the difference between semaglutide and tirzepatide. Okay, so semaglutide is going to be, there's different receptors that have to do with our appetite regulation. So there's the GLP-1 receptor, and then there's a GIP. There's even another peptide that's still having its clinical trials. Retatrutide. I don't know exactly how they want it to be said, but that's the one that's really having a lot more research on it right now. And that's probably going to be the next one that comes out. That also has a glucagon agonist effect as well. So basically, you start with the semaglutide, that's a GLP-1 agonist. That one is going to help with that one receptor in terms of appetite suppression and all of those things. Tirzepatide is going to do the GLP-1 and the GIP. So that gets at two of those receptors. And then this retatrutide, whichever, that's going to get at the GLP-1, the GIP, and the glucagon agonist. I think this is always the way things go. We're trying to make things stronger and better and faster, which isn't always a good thing. Sometimes it's better to go a little bit slower, but the emerging research for this new peptide is actually really, really good in terms of, yes, lowering your hemoglobin A1C, lowering your blood sugar, weight loss, as well as helping with things like non-alcoholic fatty liver, reducing triglycerides, things like that. So having even more effects than the other ones, than the older ones. Now, that's not to say that semaglutide might not do that for you. When it comes to which one we're going to choose, it really depends on what your symptoms are. If you're like, I have a little bit of weight to lose, I don't have really strong cravings for anything, maybe I'll start with tirzepatide because it does, in the research, show more weight loss, usually a little bit less side effects. Or if you're someone who's like, no, I crave all my candy at night, or I crave my wine or anything like that, I'll probably go with the semaglutide. Then yeah, like if you go off a GLP-1, will I gain the weight back? So, yes, you can. If you think about, okay, my appetite has been reduced and then I go off and my appetite is now where it was again. So that's why it's so important to either, if you know how to do it yourself, or work with someone who's going to help you with that transition. So that's why whenever, when we have, like anyone who works here, myself, when I have a patient who is on one of these peptides, we're always talking, before we go on it, we're always talking about, okay, what are we going to be eating? We're going to be increasing our protein and fiber intake. One, because you're getting that protein in so we can maintain, if not gain, muscle mass while we're on it. Two, the fiber is going to help with your gastric motility, your making sure you're still able to go to the bathroom. But also because those two things are going to help keep you satiated. So if we have those habits now while we're on it, once you come off of it, you'll be better off because you'll realize, okay, a lot more hungry again, but I'm going to reach for some protein and fiber because I know those are going to keep me full for longer, as opposed to, we all love carbs. I don't know who doesn't love carbs, but if we're going to reach for just a simple carbohydrate, it's going to satiate us for a little while, and then we're going to be hungry again. So, and that's also going to mess with our blood sugar. So having that kind of that diet under control where you know what you're going to reach for when you are more hungry, and also how you taper off of it too. So it's not just going cold turkey. I was on this many units and I just stopped. Usually we're going to try and taper down so we can get adjusted to what it's like as our appetite comes back. What little adjustments do we need to make? So yeah, so those would be the main things. Supporting your own GLP-1 production, because we have seen that there can be a little bit of a dip in how much GLP-1 you are producing, because I know I talked about it in the webinar. There is a reduction in how much GLP-1 you are producing naturally. So we want to get that to go back up after we've been taking the GLP-1. Some of the things that can help that are certain probiotics. Certain probiotic strains help to improve your own GLP-1 production. So we can either take those probiotics, and we can also keep those probiotic bacteria happy by giving them the prebiotics. So things like that, usually in combination, are going to help with that transition off of the peptide. And also, this is a peptide. This is something that you could, we have people cycle on and off as they need it. It's like certain medications that kind of get you out of a hole. Okay, I needed this help to get me out of here, get me out of this hole, get me on this weight loss journey. I'm back in the gym, I'm working out, I'm eating better. I needed this, and this really helped me, um, like I said, out of this hole. So if you're doing well for a while, then you're like, oh, I need a little bit of help again. The peptides are fairly easy to start and stop like that too. So that's nice. Again, there is so much research coming out all the time. 2 research papers just came out in June, and they were conflicting, of course, because I know well, I've seen a lot of the papers come across my email about eye issues and the GLP-1s or these types of peptides. So the one that just came out was for wet AMD, or wet age-related macular degeneration, and it was conflicting. There was 2 studies, or there was one big study and then one journal article that came out. The one said that it can increase the likelihood very slightly, and the other one said it actually protected. So this is why, I know we get a lot of clickbait. We're like, oh, these cause this and that, because it's what's going to get our attention. So always talk to someone or try to dig deeper and see, when did this research come out? Was this a randomized control study? What kind of study was this? Before we're jumping to too many conclusions, both good or bad, because so far the research has been really, really supportive of its effects on blood sugar, or their effects on blood sugar, reducing major cardiovascular events. Obviously, the weight loss leads to that trickle down effect, lowering inflammation, having neuroprotective effects. So lots of benefits so far, and even some of the more commonly known ones like pancreatitis. There was initially some concern about it increasing pancreatitis risk, but that has not been shown to be much of a case. For the people who were already regularly getting pancreatitis, just that would be awful. That it's definitely not recommended, but again, that there's a deeper issue there. We'd want to address why they're getting pancreatitis. Also, rapid weight loss of any kind is going to put a strain on your pancreas. So again, this comes into making sure that we are having slow, sustainable, steady weight loss, not anything rapid. Let me see. Okay, we got another question. Should I be tracking my body fat and muscle while I'm on a GLP-1? Yes. So that was another issue that some people were concerned about. They're like, okay, if I go on this, I'm going to lose all my muscle mass and I'm going to lose bone density. And while there's actually some studies that show that these peptides actually help with skeletal muscle mass, so like not our smooth muscle, but our actual our muscles, there is concern of long-term use of it, and muscle loss and bone density loss. Again, I think this comes down to how we are using these, what we're eating while we're on these, and what kind of exercise we're doing. So again, I harp on about this all the time, but the non-negotiables of weight training, you want to be doing weight-bearing exercise so that you are, yes, helping to build muscle. We want to, at the bare minimum, maintain your muscle mass, if not build muscle mass, because that's only going to make you more metabolically healthy. So yes, gaining muscle mass, eating enough protein, doing the weight training. The weight training is also going to help with your bone density. So, luckily we're seeing more and more information come out for women who are going through perimenopause and menopause, and how to maintain and not lose bone density during this time of our hormonal shifts. So weight-bearing exercises, I know jumping exercises, but those are the types of exercises that we want to do. And the nice thing about being able to, if you're able to, like we are able to here, track your body fat and muscle, you can see, okay, yes, I'm losing weight. What am I losing? Am I losing mostly body fat? Perfect. Are we losing body fat and a bit of and too much muscle? Okay, we need to adjust things. We need to figure out how we can maintain our muscle mass, if not gain. And so again, that's where the whole diet and lifestyle comes into play. As with anything, it's never just the medication or the peptide or the supplement on its own. All those other factors make such a huge difference to how you're going to respond to it, how well it's going to work for you, how sustainable it will be, and how successful it will be in your outcome. So yes, the answer to that would be yes, if you can. Like I said, we can do that here, tracking body fat and muscle. and really see the areas where, you can even tell per limb, like, okay, where am I gaining more? Where am I losing more? Where do I need to gain more muscle? So that's really, really handy. And that's a nice way to keep track of the changes over time and make sure that we're doing this in a safe way, a sustainable way, so you're going to come out of this much better than when you first started. Let me see. I think there were some other main questions that seem to pop up in terms of these peptides. The other thing as well is that unlike other blood sugar management medications, these types of peptides are much less likely to cause hypoglycemia, meaning like when your blood sugar drops and feel dizzy and hangry and irritable. So that is also in terms of people asking, hey, can I be on these long term? We do have some long term data. Of course, a lot of this is for people with diabetes. But in terms of long-term use, they have much less of a chance of causing hypoglycemia. Some of the things we ask about is pancreatitis. Just to put to rest as well, we always ask about thyroid medullary cancer and multiple endocrine neoplasia type 2. So there are two types of cancers. The main concern initially was that the actual risk that they found was in rodents. So, we still take that into consideration. That's why we still ask. And if you do have a personal family history, we're going to take that into consideration, likely not use these peptides with you. But these were found in rodents and so far not in human studies. So that is really good to see, which just goes to show, we can extrapolate things from animal studies and as much as we can, but it's not always, one-to-one. You're not a rat, I'm not a rat. So, like I said, we're continuing to see more and more data all the time because these are so popular. There's so much research going into them and all the different effects they could possibly have, that this is going to continue to change daily. Like I said, just those two studies came out just this month. Both are conflicting about the eye disease. But that's just the way this goes, and that's why we stay up to date with these all the time, so we know what's happening next, what do we need to adjust, and that's why it's so important to have a physician or someone who is a medical professional is going to help you through with these things, because I know that these are widely available all over, but someone who's going to make sure you get a quality product and that you that they're following the data, they know what's going on, they know your own personal and family history. That's very, very important. If you do think of any questions, like I said, we are always here. Please give us a call. We can always start with that, like a little 10-minute call to see if this is going to be the right fit, but most of the time it is. But feel free to ask us any questions. And we're here to help you through with these. I know there's so many different peptides. They can get confusing. And again, you want to find someone who's going to go through them with you, go through your own personal and family history, and make sure this is the right fit for you.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.